describe some of that?
First of all, I think any and all forms of attacks against healthcare are truly heartbreaking incidents, and there's nothing can justify anyone attacking either health facilities, healthcare workers, ambulances, or even preventing patients from seeking healthcare. It's a basic human right, and in times of conflict, health services are even so much more critical, like they're even more life-saving than under non-conflict situations. Um, Unfortunately, what we are seeing, though, more and more is that um, health facilities are being attacked. They're sometimes even targeted for attacks. Um, and occupying a health facilities for other purposes than providing health service is also an attack against healthcare. And I think in all conflicts you would see, you know, different degrees, different variations to attacks on healthcare. I don't think any country or any conflict is immune to that. Um, what bothers me the most, however, is how can we get out of it? Like how do we engage people, authorities to make sure that health is protected? I don't have an answer to that, obviously, but it is extremely concerning. What we try to do is really just, speak out, bear witness when these attacks happen. But I think it's truly a collective effort for which I think also the public at large need to also have a stronger voice in condemning any and all forms of attacks on healthcare. So healthcare workers need to be protected, and we've seen it doesn't even require conflict. Even during COVID-19, during the pandemic, so many healthcare workers were attacked in a form or another because they're being prevented from delivering their service. They're being harassed on the street, for example. So I think there's a lot of individual contributions from even the general population to actually do something about it. And so my message is really, please speak up and continue calling, condemning, and denouncing any incident of attacks, small or big, that you may be aware of.
Thank you, Teresa. And as we're here at the World Health Assembly, just to mention that the World Health Assembly is composed of 194 member states who make kind of the decisions, the rules around how WHO operates. And one of the decisions was that WHO should report on attacks on health, should advocate against them. An attack on healthcare is considered, under the international humanitarian law, it's forbidden. So it's really important that we do this work. And maybe at that, I'll ask our WHO representative in the DRC, what is the scene there like? Is it safe to be a health worker? Is it, what are the challenges?
No, thank you. I see it in 3 or 4 dimensions. I just want to say it's not okay to attack a health facility. In DRC, especially where we have war, our health centers have been transformed into military barracks. So instead of providing health or care, these are occupied by, fighters. So not only the facility, it means that the healthcare workers had to run away for their life. While in a conflict zone, people are looking up to us as healthcare workers to provide protection, to provide health. But yet, our healthcare workers became more vulnerable than even the population. So this is not okay, and I'm glad at the World Health Assembly people will be speaking against this, because you can expect a conflict going into bushes and people run to the health center, but there is no healthcare center. It means that the pain become double. You left where you are, you come to seek help, and you come to seek help or shelter, and there is none. Second, and I think the colleagues talk about partnership. Partnership is key when it comes to responding to all these humanitarian crises. Recently, in what you call one of our provinces called North Kivu, is where we have government fighting M23 fighters. There were a lot of people who were wounded. WHO was working with partners such as ICRC, Médecins Sans Frontières, and others. WHO has provided trauma kits, many of health kits to save lives. So this helps us because WHO alone cannot do it. But we have also people working on the ground who are really specialized in critical, humanitarian care and urgent care to help emergency care to help save life. Because when you are there, wounded, you need sometimes little just can save life. So this is why I think also partnership plays a role. But when it comes to protecting health facilities and healthcare workers, I think we must understand that these are, I won't say humanitarian actors by essence, but these are people who have nothing to do with ongoing conflicts. Themselves are victims of the conflict. So if we can protect them, for them to protect the rest of the civilian population, I think this is what we should advocate. And for all countries meeting here in Geneva at the World Health Assembly to understand that it is a human right or it is our duty to protect our health facilities and to protect our healthcare workers.
Thank you, WR. Health is a human right, as we say here. We've covered a lot of outbreaks, we've covered attacks, we've covered coordinating with partners. I think there's one more aspect of health in times of conflict that's really important for us to speak about, which is hunger. They say famines are often man-made, almost always man-made, and we see a lot of hunger when it comes to conflict. So maybe I'll ask Andrea, why do we see so much hunger? And then what is WHO or what is the health sector's role in addressing this hunger?
Okay, thank you. I'll phrase it in terms of the social determinants of health. We all need, shelter, we need food, and we need water at a bare minimum to try and survive. But when we don't have food available to us, if I cannot feed myself and my family, my health status will deteriorate, and I will become, or my children and my family can become more susceptible to various illnesses. What happens in a conflict setting where you have a prolonged period of deprivation or not enough food, there are various aspects that play into the status of your health. What we can see in the situation of Gaza is that over time people reported losing weight, and then slowly there were reports of cases of malnutrition. This is in an area where there was previously no cases of malnutrition that was reported. And that's why the health partnership under the nutrition cluster was brought together to try and make sure that there was an ability, the capacity and the medical staff and supplies to detect and then respond to cases of malnutrition, which are still being reported.
Yeah, it's one of the grimmer sides of conflict. I don't know if the mics are catching the background noise, but I think that's our cue to wrap up here. Unfortunately, even though this is it's a long conversation to be had, but I'd really like to thank our guests for sharing their perspectives, sharing a bit of what WHO does, and we'll be here to talk more about it. And of course, this work is ongoing, never ending, so we will be speaking more about it in the coming months. So thank you to our guests, thank you to those who joined us online, thank you to our teams behind the scenes. This is us saying goodbye to you from Geneva.